Hello, everyone. Welcome. We'll just wait a minute to let everyone file into the room, and then we'll get started. Okay, so I think we'll get started. Hello, everyone, and welcome. My name is Kerry James. I'm Chief Executive of the World Hepatitis Alliance, and it's my great pleasure to chair this launch of the 2025 theme for World Hepatitis Day. Next slide. Oh, no, I have the slides. Hmm. I have the slides, but I can't move them. Oh, there we go. So we do have interpretation available today. So on the bottom of your screen, you just see the interpretation symbol. So please just choose the language that you would like to hear it in, and it will automatically switch. I'm not quite sure why I have such a delay on my. Sorry about this. Let me just. Okay, so our agenda today, we'll be talking about World Hepatitis Day, the messaging. We'll take you through the materials, and then we'll have a good amount of time for question and answers. And then talk about how all of you can get involved in World Hepatitis Day, because we all know the great work that you do. So we have some suggestions as well, and hopefully we'll be able to talk about some ways that we can collaborate. We'll talk about the timeline to World Hepatitis Day, and then have some time for discussion at the end. So I'm just going to have to, excuse me just for 1 minute. I'm just going to restart this because it's too slow, basically. So if you just bear with me just for 1 minute, please do introduce yourselves in the chat so we know who we're sharing this time with. That would be great. And just give me 30 seconds and we'll be back. Right. So about World Hepatitis Day. Well, I'm sure most of you are familiar with World Hepatitis Day, but it all started in 2010. So this is our 15th or 16th World Hepatitis Day as an official UN recognized awareness day. And I think we all understand the urgency to address hepatitis. How many lives are lost each year? 1.3 million in the last global hepatitis report from WHO. And that's a rise from the previous report. So the numbers are really going the wrong way. And we still have more than 300 million people living with it. So Hepatitis Day is more important now than ever before. So our theme for this year, for 2025, is let's break it down. And I'm just going to read the kind of mission statement for the campaign so you kind of understand the thinking behind it and how we think it can be used. So each year, more than 1 million people lose their lives to hepatitis, and the number of deaths are rising. But why? We have fast and accurate tests, effective and affordable treatments, and a proven vaccine that can prevent 95% of newborns from getting hepatitis B. But low awareness, misinformation, myths, and stigma are stopping people from accessing hepatitis services. and leading to a lack of action by decision makers. This World Hepatitis Day, let's break down the barriers that are holding us back from a hepatitis-free world. The World Hepatitis Alliance, our partners, allies, and over 400 members around the world are calling for action to end this entirely preventable disease. Let's break it down so everyone has the knowledge and understanding they need to make informed choices about hepatitis testing, treatment, and vaccination. Let's break it down so that decision makers become advocates, providing the resources needed to improve the lives of affected communities. Let's break it down. Oops, excuse me. This window is in front of my text. Let's break it down so we can finally end the stigma for people living with hepatitis and ensure no one is left behind. Let's break it down so everyone sees that hepatitis elimination is not only possible, but achievable if we all work together to make it happen. So that's the overarching mission and vision for the campaign. And then on a practical level, we have 4 different calls to actions within the resources that Steve's going to talk about in a minute. So we have calls to actions around testing, call to action for treatment, one for vaccination, and one for the prevention of mother-to-child transmission. So with that, I'm going to hand over to Steve to talk about the materials we have available this year. Steve.
Thanks, Gary, and hello, everyone. It's fantastic to see so many of you here today. Great pleasure to show you these materials. First up is campaign guidelines, which also features these materials. So you don't need to worry about taking any notes during this presentation. They are all in the guidelines. So if I could just go to the next slide, please. As any of you who've done World Hepatitis Day before knows, we produce various materials, but some of the basics, the foundational materials are going to be posters. If you're doing anything in person where you are, these posters are available for you to download for free. We have been working with the messaging of Let's Break It Down, phrasing things as questions and answers as a way to introduce those calls to action that Carrie highlighted previously. So examples here, questions around, I don't feel sick, could I have hepatitis? Then an answer of yes, millions of people have hepatitis, but most don't have symptoms. Testing is the best way to protect your health. Get the facts, get tested. So we have these question and answer proposals on the posters to help grab people's attention and to introduce these different calls to action. If you have more specific things in your region that you want to focus on, though there's a whole range that you can select from. They are also available in 5 languages. We have them available at the moment in Arabic, English, French, and Spanish, and Chinese is going to be added beginning of this week, just coming up. So if we can go to the next slide, please. Thank you. Social media is obviously another huge part of the campaign, getting communications out into the world at a global level via social media. We've adapted the messaging to, again, draw attention through questions and answers, but also statements as well. So we've got in the bottom left here an example of the question and answer proposal that we've just looked at. We also have these statements, such as in the middle, where it's just saying you can protect your baby from hepatitis B by vaccinating them at birth. These are the facts that we're talking about, the get the facts. So we can present these statements there. And then on the right-hand side, you'll also see carousel versions. If any of you use Instagram, it's a very good opportunity to have multiple photos in a post that people can swipe through. So it's a way of bringing that to life a little more based on how people use social media these days. And that makes use of the question and answer format as well. Again, these are all downloadable for free. And they will be available in those 5 languages as well. Next slide, please. For any specific messaging that you want to work with, or any languages that aren't covered by those translations. Or if you want to add your own logo, your own work that you want to highlight, we have our poster tool online. Again, anyone who's done World Hepatitis Day before may well be familiar with this. What we've done this year is, and Ben will show you how this works in a moment, but we followed that question and answer format as well. So it'll all still be in the same visual style. It'll be the same question and answer style, statement style as well. And Ben will show you through that in a moment. Next slide, please. And similarly, we have social media tools as well. These will be a bit simpler, but also a lot more personal as well, being able to upload photos of yourself, for instance, and adding in the caption about supporting World Hepatitis Day this year. Next slide, please. As mentioned, translations with Chinese on the way. And next slide, please. The website is now also live for you to take a look at, and I'm going to hand over to Ben to give you a quick tour.
Thank you very much, Steve. Let me bring up the website for you all. Right, hopefully you can see that. It's great.
Sure can.
Fantastic. Hello, everyone. I'm sure many of you will know me by now, but for those of you who don't, I'm Ben. I'm the operations manager here at the World Hepatitis Alliance, and I've been part of many World Hepatitis Day campaigns, as I know many of you have as well. So I'm sure you're very familiar with generally the way the World Hepatitis Day website works, but for those of you who aren't, this is what it looks like. So we've obviously updated our homepage to reflect the 2025 campaign. Everything on the homepage, Carrie and Steve have just touched on regarding the messaging and the campaign for this year specifically. Get the facts, take action. You'll see some at a grab facts here on the homepage, which you can use in a preview of some of the assets which are embedded throughout. And as you scroll halfway down, you will see the three key areas. Well, there's really two key areas of the site. One is the take action page, and the other is the campaign resources page. I'm going to focus on the campaign resources, or rather the campaign materials section of the site. But before I do, just to show you the briefly the take action page. Oh, and a little bit further down, you can read last year's report. So you can see all the incredible activities all WHA members and others got up to in 2024. So if we click take action, you will see a variety of suggested actions that can be taken for this World Hepatitis Day. Toby will go into some of these in a little more detail, but they range from some social media activities through to letters that will be submitted to policymakers, etc. But I'll let Toby guide you on that. But let's take a look at campaign resources. So Steve ran through all of the key assets that we have this year. This is where they're all based. So when you come into the website and you click on campaign resources, you will see everything here. So I'll just give you a quick summary overview first. We have the posters, all the A4 posters. So that's both the Q&A poster Steve was mentioning and the statement-based posters in all the languages except Chinese, which will be coming next week. The social media assets, both square and rectangle, some for Instagram, some for Twitter or X rather, and Facebook, and the carousel images. Now, forgive me, I don't think Steve explained exactly how those work. So let me just show you these quickly. So the carousel images are for your Instagram feeds, for example, and perhaps for one or two other online formats. But the idea is that you download the images in bulk. So you can see here, carousel 1A, B, and C. So you would use those three images so you can swipe through on your Instagram feeds to keep that question, answer, messaging flow through your social media. You will see a number of different options for those as you scroll down on that page. And we also have the campaign guidelines, which, as Steve said, is there for you to refer to so you know how best to use all of these things going forward. We have some World Hepatitis Day logos in the various languages, Zoom backgrounds, which we are all modeling for you today, and some PowerPoint slides, which you can use for your own presentations and your own webinars. Let me just click into one or two of these quickly for you. So as you can see here, we've got the tabs for the different languages. You just select the language that you want and it will pop up. It's defaulting to English here. But if we click on French, we will get French assets. Arabic, Spanish are there as well. That applies for the social media rectangles and squares. Now, Tumani, I saw you ask for Swahili. Well, this is where the poster tool comes into play. So many of you will be familiar with the poster tool, but for those of you who aren't, this is where you get the chance to customize the assets that you've just seen into your languages, using your images and using your messaging. You can completely redo them to an extent. So these are the 4 poster tools that we have. One is the A4 poster, as you saw, statement. The second is the Q&A poster with the question and answer section. One is an event flyer where you can give a description of an event you're holding and the address and update the details, and the Instagram image or the social media image, all of which are customizable. So let me show you the A4 poster one. For example, so Tumani, let's say, for example, you want to just convert that poster as it is into Swahili. Over here, you can scroll down the languages and hit Swahili. And you can even update the core messaging here. At the moment, it's defaulting to get tested, but we have some other variations there. So let's say you want it to be protect your family. And let's say you wanted also to change the image here. Let's say you wanted to use that image. You hit update poster, just give it a second, and it should churn out the poster that you want with your messaging. There we go. You can, of course, also completely edit the text. So it's not the default messaging, which is here. You just come to add your own images, logos, and messages down here. And this is where you get the chance to upload your own image. So you can use your face as the core image, for example. You can change the text boxes here, which obviously relate to the text boxes in the poster there. You can even add your organization's logo. And when that's uploaded, that will pop up alongside the World Hepatitis Alliance logo. So that was Swahili on that one, for example. Exactly the same process for some of the other ones. So here's the Q&A poster tool. So let's go ahead and add in some just change the messaging here, and let's just make that a very simple yes. Update the poster. Oh, sorry, Sylvia, just a quick message. I can hear the translation coming through. Thanks. There we go. Obviously, a very short message, which I added in there, but as you can see, it will be fully customizable for whatever you want there. And then you can change the images, change the languages, update the logo. I won't go into the event flyer because same details apply. You just go in there and add your own text for whatever event you have going on. And finally, the Instagram image or the customizable social media image tool is here. Everything stays fixed on this. So I am going to get rid of this language option because you unfortunately cannot translate the messaging because we want to keep let's break it down as core messaging. So that can't be changed, but the image can. That's where you get the chance to upload whatever image you would like. And you just update the poster. And once it's ready, you click download. You can save it as an image or as a PDF and use it to your heart's content. There will be more assets coming in the next week or so, so do keep your eyes peeled. On this page, we'll of course email you to let you know that there are more releases on the site. But for now, I will hand over to Toby, who will give you a little bit more information on how you can take action. Thanks, Toby.
Thank you. Can I have the slide up, please? Thanks, Ben. Hi, everyone. My name is Toby, and I'm the Communications and Marketing Officer here at WHA. Can I please have the slide up? Okay. Thank you, Carrie. Right, so there are various ways that we can take action and just get involved in WHD this year. And the first one is through the virtual relay. Yeah, thank you. Right. So one of the ways that we can work together this year is through our global virtual relay, where we share videos at 12 p.m. for the various time zones throughout the 20th of July. And so what we need from you is to record a 30 seconds video of yourself or of your organization speaking about what hepatitis elimination means to you or what you're doing for WHD this year. It's very important that you share these videos with us early enough so that we're able to compile them ahead of WHD. And you can send these videos to us on our contact inbox, which is the contact at worldhepatitis-alliance.org, and you can find even more details about this on the website. Next slide, please. Another good way that you can raise awareness this WHD is through Vox Pops, especially because our theme aims at breaking down stigma around hepatitis. So what are Vox Pops? Vox Pops are just short videos that we compile from interviews with members of the public, and they're a very engaging way for you to find out what people think about a particular subject, and in this case, that is hepatitis. So you just go out on your streets, in your community, and with their consent, of course, ask people questions around hepatitis, and then you can compile these videos together and post on your social media pages. And don't forget to also tag us. You can find more details about this on our website or the campaign guidelines that Steve took you through earlier. Next slide, please. Right, another way you can raise awareness, and something that you can do like in less than a minute, is to create a personal Instagram or TikTok reel sharing what hepatitis means to you, or again, what you're doing for WHD this year, or even just sharing some facts about hepatitis. So whatever creative way you choose to raise awareness, all you just need to do is just post this on your Instagram or TikTok or Facebook page and then tag us so that we can repost it for a wider reach. And then you can also share some of the static graphics that Steve has shared earlier on your WhatsApp channels or other social media platforms, so you can raise awareness with your family or your friends in your community. I think that's it from me from now. I'll just hand over to Steve to kind of give you more on longer actions.
Thank you, Toby. We can come back to something that was touched on earlier as well, is that coming soon we also have a film. The film is going to be downloadable, so you can make use of this however you wish. Oh, thank you, Karen. So this is video content that's currently in production that works on this same principle of breaking down myths and answering questions about hepatitis, taking that question and answer format. We've got some great, very engaging experts who are going to be answering these questions, and we can't wait to show it to you. So when that's ready, we'll be able to be sharing this online across socials, but you'll also be able to download it to make use of in-person meetings or any kind of presentations you're doing, community meetups, things like that. So we will, of course, email you when that's ready. Some other longer actions that you can take. Thank you, Carrie. Events, as mentioned, you can show the film at events, but events, webinars, these are great ways to bring attention to hepatitis within your communities. Also arranging advertising, billboards. We've got some guidance about that on the World Hepatitis Day website. Sometimes billboards, they have some available slots, so it could be that you can make use of a billboard to talk about World Hepatitis Day. If that comes up, then you can always contact us at contact@worldhepatitis-alliance.org just to get some advice on the kinds of things that you could display on there. Lighting up local monuments is a storied tradition around World Hepatitis Day. So please do continue with that. It's wonderful to see each year. And also we have some guidance on that on the World Hepatitis Day website as well. Under the Take Action page of the website, you can find a template letter to engage local policymakers as well. So we'll draw attention to that in emailings between now and the day itself, and give some guidance on ways to approach different policymakers. But that's as basic as letters might seem, is an extremely useful and important way for us to execute advocacy work. And influencers as well. This is something that we've been trying with the World Hepatitis Alliance's work. There are a lot of influencers out there on social media who have very, very big followings. If there are people who are trustworthy as influencers, then it's really worth reaching out to them and talking with them to see how we can spread the message of WHD and really try and get that global attention on social media. Again, this is something that we can talk with you about if you wanted some further advice on it, as I appreciate it can be a new area of work for some people. So next slide, please. Thank you. And yes, as World Hepatitis Day comes up, we have 3 key webinars that we would love for you to join. On the 22nd of July, there's a webinar that's spotlighting hepatitis A. On the 25th, so the Friday before World Hepatitis Day, we'll be hosting our annual community forum that we always do before World Hepatitis Day. This year, the focus will be on stigma with perspectives from people living with viral hepatitis. And then on the day itself, Monday, 28th of July, World Health Organization will be doing their global hepatitis webinar as well. So that will be it'll be a fantastic event to see you all at, because obviously WHO has such a wide reach. Next slide, please. And here's just to lay out the timeline, since I know that we've thrown quite a lot of information and dates at you. The timeline starts with today, 5th of June, with our launch event. Between now and mid-July, it'd be great if you were able to submit your WHD relay videos to us, just because we need to process them at our end and schedule them, and it just helps in the run-up to get those in as early as possible. So if you could send those through to contact@worldhepatitisalliance.org, we'd really appreciate it. Mid-July, we'll be premiering the video that I mentioned, and that'll be a big push out as well. So we'll let you know about that, and we can give you advice on ways to push that out to your own networks. Then, as mentioned, Friday 25th, the community forum webinar that we'll be hosting. And then on 28th of July itself, let's break it down. Let's attend the WHO Global Hepatitis webinar, take part in the WHD relay, and just generally get people the facts they need to protect their health. Next slide, please. So now, as I mentioned, we've thrown a lot of information at you, and it's time for you, if you have any questions, to let us know.
Great, thanks, Steve. So yeah, please do put your hand up, and I think I can see that the hands, but Ben, maybe you can help me. But Samantha, you've had your hand up for a while. If you'd like to unmute yourself and ask your question or make a comment, please. Samantha McAllister, did you have a question or want to make a comment? So if you, Ingo, if you put your hand up, then Ben can, yeah, it's okay.
Okay, can you hear me?
Yes, we can hear you now.
Thanks. I already got a helpful internal message that I can ask for help with the translation. So I think it's a cool idiomatic logo, and we would have to find ways to explain it in Germany so that people understand what we mean by let's break it down. And I'm considering 2 options. One is to just use the logo as it is, which would be less effort, and just put a small German subtext under it that basically says, let's be clear about hepatitis, or something like that. Other things would probably be too invasive for the logo, which has a certain design, and it should have like the most important word in the middle with a red background. So do you have any advice how to best go on about this? I don't know if other countries would also look for ways to explain this in their languages.
Sure, thank you so much. So we did consult on this to see if "don't break it, let's break it down" is translatable into other languages. And of course, nothing is universal. But the feedback that we got, or the predominant feedback that we got, was that people are used to seeing, in many countries, used to seeing some things in English and advertisements and things like that. So the preference was to keep the logo in English and then
Yes.
use the text around it to explain it. So I guess the second option that you explained would be a really good one. For
That's
exactly
good.
the
That's
reason
such
that you
close.
that you laid out, is it's kind of, with the way the logo is set up, in every language it's formatted differently, so it's hard to get it to fit into that shaped logo in every language. So we're really happy to try to translate it and see if we could get it to work in a language, or for you to add a tagline on the bottom. Either way, but yeah, that's what we kind of determined was going to be the most efficient way to do it universally. But of course, as with anything, if anyone wants a custom logo in a custom language or whatever, just email the contact email box, and we're really happy to provide those things for you.
Yeah, I would suggest to my team to do a combination where we use the original and maybe put a little explainer under it, because sometimes we do that with English movies too. We keep the English title, which sounds kind of cool, and then we add a little like German translation to it. So I think that could be a good way to go on about it, with not as big effort and redesigning in different languages. But
Great.
thanks.
That sounds perfect. Thank you. Great. Okay, I don't know, Samantha, your hand is still up. Maybe you put it up by accident, but if you do want to ask a question, please let us know.
I'm just going to quickly jump in. I've seen something in the chat from Ali Aldoa mentioning what's related to Arabic about flash drives. I'm not quite sure whether this is correct, but I did want to say that regarding the film, we, as standard, we subtitle our films using open subtitling formats. So for anything that might require, say, with the film, if there's a flash drive with downloading, the film will have subtitles that can also be translated automatically into the language of your choice. So Arabic would be something that you could translate the film into as well. Apologies if I haven't quite got right what you were asking there, but it's a broader point that I think is useful for people to know as well.
Great. Thank you so much, Steve. Any other questions or comments? Please put your hand up, or you can type it in the chat as well if you'd like to. Tumani, I think your hand was up for a moment. If you would like to ask a question or make a comment, please.
Thank you. I take this moment to appreciate the team for preparing for the presentation for the Hepatitis Day. But I would like to know if the same theme is going to be used also by WHO or not, because I know in some of the country, including ours, they use the WHO theme, they adapt it and they started to use it, take action as a way of commemoration of the Hepatitis Day. So I wanted to know that if it's going to be used by WHO.
Sure. I don't know if anyone from WHO is on, but if they are, please feel free to raise your hand and chip in. But it's my understanding that it is going through WHO kind of approvals at the moment, and we think the chance is pretty good, although we don't have a guarantee that WHO will be using the same theme again. I mean, last year they used the same wording, but they used slightly different visuals. But this year, I think this year will be the same, but I just can't confirm that with you at the moment. But we do that is our hope, that we will be 100% aligned with WHO on the messaging. Thank you.
I can respond to Marinella's question around creating posters similar to our layout, but that work with guidelines for other things, such as the hospital that they will be working at. Absolutely. This is why we've also provided logo files for people to make use of, because context is everything. So feel free to take some of these components and create your own posters. And of course, do feel free to get in touch with us if you need advice on anything around this. We're here to help out.
I think likewise the question about the WHD flag. For sure, you guys could use the WHD logo to design a flag, and if you needed help coming up with the specs for that, but it's we can obviously do that. We don't create materials centrally and try to send them out, because the customs arrangements in each individual country makes it really very, very difficult to get actual materials into countries. So we can provide the artwork, we can provide any kind of creative support for that sort of thing, but then yeah, it'd be down to you guys to get them printed locally, then used. But I think it's a great idea, and we'd love to support it. There's a question in French. I don't know if someone can do a quick translation. I don't have access to the interpreters.
So
I think on the
sorry, Kate, that question is, do we have to make a 30-second video for each country to show what we do as an activity? I suppose that's related to the relay, Steve.
So with the relay, it's we suggest people can do it as individuals or as organizations. It's really your call what you want to speak about during the relay. It could be that that's your moment as a call to action to discuss your national priorities, or it could be something very personal. This is kind of the thing about World Hepatitis Day. There's so many different angles and dimensions to it that really we want to allow everybody to work on what is going to help their own work the most. So if for you it's useful to talk about your country context, then please do go for it. And I'm sure that that will end up reaching further and can be used as an advocacy tool in itself. But if you also just want to talk about the work that you and your organization are doing and draw attention to that, that's absolutely fine as well.
Great. So yeah, Karen, just for the suggestion on the flag, I mean, obviously I think the World Hepatitis Day logo could be quite good, but do send us an email at contact@worldhepatitisalliance.org, and then we can ask our designers as well if they can maybe think up something for you, or we can give you some more suggestions. And then if we come up with a great design, then we'll put it on the website, and then everyone can use it, really. And the question about the press question. So we're still looking at this. Obviously, I mean, what interests the national press and what interests like a global press can be quite different. So, I mean, maybe that's something we could talk to you about in Argentina, about whether we can look at some data points in Argentina that could be interesting. Obviously, there is always new data updated to the Polaris website about the prevalence or the hepatitis situation in each country, and you can look at the trends, whether it's going up or down, and then tailor that into your press release. But keep an eye on, I mean, you're on the mailing list anyway. We'll have suggestions between now and World Hepatitis Day about different hooks that we could use and different press points, but we don't have new data from WHO. The last data was presented last year, but we'll have new data next year in terms of data points. But yeah, happy to work with you to find something that works well in Argentina. There's a question there for Ingo. Can you see it, Steve?
Yes, that's asking about being able to use the original photos that we have in the tool. I would need to double check on that, as we've licensed those. So that's something we'd need to get back to you on, about whether they can be distributed outside of the context in which we're using them. Just to add as well on the answer about the press, we have a lot of work at the moment that WHA has been doing, drawing attention to different aspects of hepatitis, which we'll be mentioning towards the end of this webinar. These are all things that are providing new data and new insights as well. So these are the kinds of aspects that we'll also be drawing attention to as part of World Hepatitis Day and in our own communications with you and to the public. So yeah, there's some exciting work that we've been doing that I think could give some ideas as well.
And also, I'm going to mention, like Steve said, the recent white paper on liver cancer, and that actually has some new cost effectiveness data from the CDA Foundation in it. I'm talking about how hepatitis elimination is cost effective or cost savings in most countries for reducing cancer cases. So have a look. It's all on the WHA website, worldhepatitisalliance.org, and it's all flagged from the landing page. You can find the link. So there is some new data in the liver cancer report that can be used for sure. I don't know if there's any other questions in the chat. And just in terms of stigma, the stigma report that we did on the pilot that we conducted in Europe is also been published by the European CDC, which we'll also talk about at the end. And then, so there is new data there. Unfortunately, the data that we have at the moment is only around a small number of European countries, but we're actively seeking funding to do the Stigma Watch survey in other countries around the world. So if you would like to do it in your country and you think you can find some funding to support the data collection, then please do reach out as well. Because our goal is to do the Stigma Watch in every country of the world. We're just working on finding the resources to do that. Any other questions or comments? Any more questions in the chat?
Just in response to Wynn's question around the meaning, purpose, and information of the campaign itself, I'm going to drop a link to the campaign guidelines in the chat. You'll be able to pull necessary information from there that explains the rationale of the campaign and is also wording that you can use in your own materials as well. So yeah, I'll post that in the chat for you now.
Great. And just in terms of translation, most of the key information from the guidelines is also on the website, and the website is fully translatable. On the upper right-hand corner, you'll see the choice of language. So any parts of the guidelines that might need translating, you can do that on the website. Betty, thank you for your point around tenofovir. I mean, we don't really get into that level of detail around treatment, but I think it's a very important point. Thank you all for your nice comments in the chat as well. There is one picture of the illuminations from around the world, but we do have some other ones on file, Karen. So just just let us know. I mean, I think we have a few of Niagara over the years, so we can definitely share those with you. But also, I think we have some from London and from other cities as well. So great. So obviously we're here, as always, for to support you all. So if you have any special needs, if there's something else you would like to know, we will be adding some other resources onto the website as well. Maybe a t-shirt design if people want to get t-shirts made, things like that. So anything you want, anything you think we're missing or you would like to see, just send us an email and we can try to create it for you and then put it on the website so it'll be available to everyone. So we've already talked about some of these already, but I just want to give you a quick rundown of some of the great things that we've been producing from WHA this year. It's been an extremely busy year so far, and we have some fantastic resources that we hope that you'll be able to take advantage of, again, for your advocacy or writing your own messaging for World Hepatitis Day. So the first one is the Beating Cancer Through Hepatitis Elimination white paper. So this is a report really laying out the overlap of around hepatitis and liver cancer and how hepatitis elimination is cancer fighting as well. And we've had great engagement not only from the hepatitis community but also from the cancer community for this paper, who really were engaged at the very start in the creation of it, going through the text, making sure that we had robust calls to action that were relevant for cancer organizations and for cancer departments as well as for hepatitis departments. And we launched this at the World Health Assembly just a couple of weeks ago in Geneva. So it is online now. Again, you can just go to worldhepatitisalliance.org, and I think most of these things are referenced in the carousel on the landing page. Otherwise, just go to the What We Do section, and they are all there. We also recently released a report on hepatitis delta, a global landscape survey, which surveyed stakeholders in over 100 countries around the situation around hepatitis delta. So we talked about whether there was people who were aware of hepatitis delta, not only individuals, but also health systems, whether people could get tested, whether there was any treatment available. And the data is really eye-opening. It just shows how much work there is to do around hepatitis delta around the world. So this is the first report. We'll be doing more analysis of the data as it goes on. But I think it's a really good resource as well for advocacy and for making the conversation around Delta more prominent. So please do check out that. And as I mentioned before, the joint report between WHA and the European CDC, ECDC, has been published and the data is out. So what you can see on the screen there is just a one-pager of highlighting some of the key data points, but there's a full report available. So please do go on the website and check that out as well. And as we said, we do hope to do this in every country around the world, and this is just the first step. Continuing, we have the Community Impact Program, which is our online e-learning platform for advocates to learn not just about hepatitis, but also about how to be more successful in your messaging, how to be more successful in your advocacy, how to be better storytellers. There's really a wealth of information and modules there. So please check out the Community Impact Program. The No Hep program, which is our medical champions program, No Hep Medical Visionaries, has been rebooted, and we have some new values and some new materials for the visionaries. And this year we also have a focus on mental health and how the crossover between mental health and hepatitis and how that can be addressed in health systems and by doctors. Because we know that the rates, especially of hepatitis C amongst people being admitted into acute psychiatric care, is much higher than the average. So we want to make sure that all of those patients are getting not only the psychiatric care that they need, but also the hepatitis care that they need. And we're very excited for the World Hepatitis Summit coming up next year in Bangkok, Thailand at the end of April. Applications will open soon, and there will also be a program for WHA members to apply for a bursary for travel and accommodation so they can attend the summit. So watch out for that, as those applications will be opening soon as well. So that just leaves me to say thank you all very much. It's fantastic to see so many engaged people at these webinars as always, and we look forward to working with you over the next 2 months to make this the most impactful Hepatitis Day, World Hepatitis Day ever. So let's break it down in 1925. Thank you so much, and we'll see you next time. Thank you.